My name is Mads Nybo. I'm a doctor at the Department of Clinical Biochemistry in Odense, where I lead the laboratory. We are quite an automated lab. So now the new instrument has not been launched, so I can't see how it will be coping with the real-time production. But my impression is that it's a huge step forward in automation. As I said, we do a lot of automation at my lab. We get around 10,000 samples a day, so we have to be many of the processes are automated in handling and processing to the analysis instruments. And this would fit perfectly into that. We also can automate that process, especially at the preanatal part, where a lot of the sample handling is prone to differences or errors. So we would very much like to step out on that. So I look very much forward to an automated edition of the LC-MS instruments. The automation will make us gain, of course, time. So we don't have to be so many laboratory technicians doing the task, but also make it more feasible for us to shorten the turnaround time so that the patients get their results quicker, which is very useful for the clinicians to have what we call same day, same stay. So they come, they want their blood drawn, they have their results, and then they go to the clinicians to have a treatment. And that would be perfect for us to speed up that process. Also, I think that automating the prenatal part, as I said earlier, would also make huge step forward. So our technicians don't have to do so much labor in terms of pipetting and all that. So we can skip that part more or less and then let the machinery do the boring work, so to speak. To my knowledge, we always get more requests when it's more accessible. So having a larger menu of analysis and have it shorter turnaround times often tends to increase the use of the tests. For now, we are doing a lot of what's called demand management around Europe, where we're trying to get rid of all the tests that's not necessary for patient treatment. And I think this will be a new area looking into that, because I think that will follow with the increased accessibility. That being said, I think also the increased accessibility is critical for the patients to have the right answer at the right time. So we don't need to wait for a confirmatory test, for example, that can take a week, and then the patient has already moved on in treatment or something like that. So I think there's some pros and cons we have to work in, but I think altogether that's what we do as clinical biochemists. So that's fine with me. What we experience a lot is that patients get more and more involved in their own treatment. And we have a lot of, for example, POCT, point of care testing, patients do at home because they can and because that gives them leverage and treatment over their own treatment. I think if we could give them the correct answer at the right time quicker, that would kind of change that focus. So the patient won't be so focused at having to do the test at home, but would rather have the correct answer at the first time. And I think this would change that, because otherwise we do a screening test and then we have to wait for the confirmatory test, as I said earlier. So I think that would change the satisfaction from the patient. And also I think it would change the, confidence that the laboratory has in professional means. When the clinicians get an answer, we say that's not the final answer. They don't quite understand. I have an answer of 2 digits. How can that not be final? Here we can give them the final answer at first, and I think that would be a great step forward also when we are increasing cooperation with clinicians and patients. So I think it would benefit from patient all the way to the treatment and the clinicians at the hospitals. So I think that would also be good for the laboratories to have that new instrument.